Hi, everybody. I'm Kenya Brown, and welcome to Black Health 365. We love to give you great information. And as we celebrate February, the month of love and connection, it's a great time to focus on more than just romantic gestures. It's about prioritizing our health, too. For Black Americans, making positive lifestyle changes is essential, especially when it comes to protecting ourselves and our loved ones. Joining us today is Dr. Gregory Hall, an internal medicine physician at University Hospitals, to discuss the importance of sexual health, the prevalence of STDs in our community, and how education and open conversations can lead to healthier relationships. Dr. Hall will share key facts, debunk common myths, and offer practical tips to help us all stay safe and informed. Dr. Hall, you always got the 411 for us.
Right. So I was thinking, I was like, boy, why I got to mess up Valentine's Day with STDs, right?
I know.
But we
This is
have
the
to do it.
perfect time.
We have
Yes.
to do it.
Yes, absolutely. So we're not wrecking it for you, but I do want you to share this information because somebody's going to need this information. All right.
Mm.
Now, Dr. Hall, I need you to break it down because you always give us some good plain talk. Now, what are STDs and what are the most common STDs affecting Black Americans?
Well, good question. And STDs really disproportionately affect the African American community. And so it's something that we do need to talk about. And, the top ones out there: chlamydia, gonorrhea, herpes, HIV, AIDS. All those are STDs that affect our community disproportionately, right?
Hmm.
And so I think it's important that we talk about it and kind of demystify, not
Yes.
demonize it, demonize it. If that's not even a word, right?
Right.
Because it's far more prevalent. As someone you don't know who has them, I tell people all the time, unfortunately, that this has happened, and they just look so disappointed in themselves, and
Yes.
they don't realize how many times this happens to so many people out there, right? And so I think it's something that once you start, it's like cancer. A lot of people don't like talking about they have cancer, but we've kind of taken, hopefully made it more that when people talk about cancer, then they start getting screened for cancer. Then they know, their uncle has cancer. It's the same thing really can happen. It's not, you are not someone who should be stoned just because you got an STD. And I think,
Yes.
a lot of people don't want to know. If I got it, I don't want to know. And that approach is not helpful to us or the community or any of your friends and family. Our message, take home messages, know they're out there, know that they disproportionately occur in our community, and that there's things that we can do.
And then, you have those factors that if you're in a relationship, in between relationships, it can be embarrassing to tell someone that you just started kind of getting into that sexual part of your relationship that, hey, I might have brought something along with me. So there is a lot of stigma that comes along with those conversations, but they're definitely conversations that we need to have. Now, I thought, Dr. Hall, that, STDs were something for teenagers or young folks to get, but everybody's getting a little something these days, right?
Absolutely, yeah. There's no age. Everyone who has sex is at risk for an STD. And if you think these old people are not having sex, you are misinformed.
I was shocked. I was
Misinformed.
shocked.
They're having sex in nursing homes. I mean, they're
Yes.
doing stuff everywhere. So I mean, and then the risk is still there. And so people think after they age out of STDs. Now, they certainly occur disproportionately in younger people, right? And people in
Mm.
their teens and in their 20s. And so that does happen. It is higher, and it does go down as you age, but it doesn't go down to zero.
Yes. So if you dating, you out there on the date naps and stuff like that,
Mhm.
you still need to know some of this stuff. Now, we know that these things happen. It happens. All right. Now, what are some of the things that we can do to protect ourselves from getting STDs and other infections?
Yeah, well, I think that the take home message, you would expect me to say the obvious, which is wear a condom and do things like
Yes.
that, which of course is true, and do your research and things of that nature. But really, I think my take home message today would be nutrition. I think people don't talk
Hmm.
about how much nutrition your health, right, and is guided by nutrition and exercise, right? And
Hmm.
then so African Americans disproportionately have vitamin deficiencies. They've got vitamin D deficiency. So vitamin D deficiency is associated with a big increased risk in catching infections.
Wow.
Related to bacterial vaginosis, which is not an STD, but and 4 out of 5 African Americans have vitamin D deficiency, and I think that vitamin D deficiency helps you. Having vitamin D, adequate vitamin D, helps you fight off infections. Right? You get less COVID, you get less pneumonia, and you get less STDs. And so, if you're Black and you're not taking a vitamin D supplement, you should be, right?
Right.
And you should.
Especially in these winter months when
Oh my
the
God!
days
But
are
we
shorter.
don't get sun in the summer sometimes, right?
That's the truth. That's the
Right?
truth.
And we don't seek the sun. We're not sun seekers. So most of us are vitamin D deficient, and we don't drink milk. And vitamin D milk, right? They used to call it, right? But
Right,
most of
right.
us are lactose intolerant, so you don't get vitamin D. So we need to take a supplement for that, and that will decrease our risk for infections, including STDs, right?
Wow.
And then zinc as well. Black people tend to be a little zinc deficient, so a little bit of zinc, not too much, can
Mhm.
help you fight off infection. That's what's in those lozenges. If you feel like you're catching
Yes.
a cold, that's just zinc, right? It's just natural zinc. And so again, African Americans tend to be disproportionately zinc deficient. So making sure you are at kind of sound nutritionally is really a good thing. Are you eating fruits and vegetables? Is there something green on your plate, like my father used to say? All
Yes.
those things can help you fight off STDs. I mean, and a condom and being judicious and acting like you have some sense, my mother would say. All those
Yes.
things help. But really, at the core, I believe, because it disproportionately happens in the Black community because of these nutritional deficiencies, because data also show we're not having that much more sex than other races or ethnicities. So if you're not having that much more sex, why would you have that much more, STDs, or that much more COVID, or that much more HIV? It's
Hmm.
not sex, it's something else. And I'm here to tell you it's nutrition.
Wow. See, I learned something new today. I love that. All right, now what should we do if we think that we got a little some, a little STD? What should we do?
Well, that's when you got to call me up, right? You got to make an appointment, or you got to go to the urgent care. It's not something you would go to the ER. You don't want to make them mad at you, but it's certainly an urgent care thing, or if you can get in to see doctors. We do virtual visits like this, and so that's easy enough. I mean, we like to check and test because sometimes people are paranoid. They feel like they have something. I've tested them, and you don't.
Hmm.
But if you definitely want to reach out to someone and have them test you. And the tests are easier now. We used to have to take probes and put them places no one wants to talk about. Now it's
Yes.
through urine. It's much
Really?
easier. Yeah, much easier test. So they give you a cup, you pee in the cup, and we test it, and then we can tell you whether you have something. So the test is not to be avoided now, if you
Oh,
know what
wow.
I mean, because
Absolutely.
it's much easier.
I didn't know that.
That's number
Okay.
two. Number two things you learned today.
We're learning all type of
All
stuff. Make
kinds of
sure you
stuff.
share this video, guys, because I'm sure somebody else didn't know some of this stuff as well. But what about the stigma that is associated with STDs? Because we know there's a little stigma.
Well, I think the it's like if you can't throw stones, you're right, man. Right? No, he is without sin, right?
Right.
And that it just people look down on people with that, and those are the same people who have a history of it themselves,
That's
and so
right.
we as a community kind of perpetuate stuff. Some things. I mean, and what didn't used to be a big deal when you cough in the store, but now during COVID, you cough or sneeze, and I had this lady look at me like I was crazy. It was like it was a sneeze. I can't do anything about that. And
Right.
I sneeze. We all sneeze, and so most of us also have sex, and most of us sometimes do things that we maybe would know better in a different situation. And so it's not to make that doesn't. These individual things do not define a person,
Right.
right? Having herpes does not define that person. It just happens to be something that happened to them. I had chicken pox. I mean, it's just one of those things because it's very, very, very prevalent. And so there's also people who have stuff that have no idea they have it. So
Yes.
if you're looking down at somebody about something, and I've had people say, they've got something, and I test their spouse, and their spouse comes up clean. Now,
Yes.
and this was, they were pointing the fingers, and I don't want to say, but it was a woman, you know, saying you go get checked, and I checked him, and he was fine, and she wasn't. So, you know, these
Yeah.
things, you know, these things happen, and so I think you don't want to look down or think any comes. Don't summarize a person just because they have a history of an STD, because a lot of us do, and it does not define any one person.
And you tend to think when you're younger that this is just this circumstance, or, I'll brush this under the rug. It's only going to affect my health today. But when you talk about STDs, when you talk about sexual health, these are things that can affect you being able to have children in the future. These are things that can affect a lot of things in the future. So you definitely want to have these candid conversations with your partner. If you're candid enough to get intimate with one another, you definitely should be able to be candid enough to have these conversations.
Absolutely, but at the same time, you know, I also have some knucklehead patients that get burnt over and over and over again, and so you know, and I give them a hard time because it's not a mistake; it's just irresponsibility. You know what I'm saying?
Yeah,
And I think that, you know, if a person, you know, if you see if you know an irresponsible person, they're irresponsible in many ways, right? You
right.
don't have to get caught, but you know, and this is a difficult to say, but you know what I'm saying? There's some people that are irresponsible.
Yes,
And if they're irresponsible with their bills, they're irresponsible with their car note, irresponsible with their rent,
right,
irresponsible with keeping the job, they're probably irresponsible in terms of STDs, right?
right, right,
And
right.
so stay away from those irresponsible people because
Look for the red flags.
they'll pull you in, and it ain't gonna be good.
Yeah, absolutely. You definitely want somebody who's responsible and mature enough to have these conversations with you, because 9 times out of 10, they're going to go get themselves checked out. They're going to make sure they are healthy and not putting you at risk as well.
Mhm.
But we'd like to thank Dr. Gregory Hall for sharing this valuable information about STDs in the Black community and how education and awareness can make a difference. If you're interested in learning more, visit wzakcleveland.com/BH365 for more details. Thanks so much, Dr. Hall.
Thank you again, Kenya.
Y'all be safe out there. All right. I don't want to talk about this again. All right.